Hi, I am Dr. Akshay Budraja. I am a senior consultant and head in the Department of Respiratory and Sleep Medicine at Akash Healthcare Super Speciality Hospital, Dwarka, New Delhi. Welcome to fittak. आज हम COPD के बारे में बात करेंगे. So COPD stands for Chronic Obstructive Pulmonary Disease. So it is an umbrella term which includes a lot of diseases which are chronic in nature. So the chronic lung disease in which there is narrowing of the airways due to inflammation, which is often irreversible and happens because of exposure to different irritants, majorly smoke, pollutants, and sometimes occupational exposure of other chemicals, which causes permanent destruction, narrowing of the airways, and leads to two different entities which can happen together or differently, which are chronic bronchitis and emphysema. So chronic bronchitis is when you have cough which is prolonged and happens every year for more than 3 months, and it is often productive. So you have cough and there is sputum and sometimes breathing difficulty, and it happens because of inflammation in the airway and the bronchus, and which is because of exposure to different chemicals, smoke, or the pollutants. And the other entity is emphysema, in which there is destruction of the alveolar sac. That is where the gaseous exchange takes place of the oxygen and carbon dioxide, in which again you experience breathing difficulty, coughing, chest tightness, etc. So if I speak about Delhi or the metro cities, it is because of the worsening air quality. The air has a lot of pollutants and chemicals which we inhale every second, and that causes this inflammation and ultimately causes narrowing of the airways, as well as destruction of the alveolar sacs, which are essential for gaseous exchange. Other than this, there is increase in the use of cigarette smoking, tobacco chewing, tobacco smoking in other forms, especially e-cigarettes, hookah smoking. So these are the major factors which are the reason for increase in the COPD cases. So the symptoms of COPD are usually, to start with, a person experiences breathlessness or tiredness on exertion when he or she walks or does strenuous exercise or is lifting heavy weight. He may experience certain amount of breathing difficulty or tiredness. That is the initial symptom. When there is full-fledged COPD which is developed, a patient experiences cough, sputum, that is expectoration, chest tightness, breathing difficulty. So these are the major symptoms which a COPD patient experiences. So the causes of COPD are, first cause is of course smoking in any form. It could be cigarette smoking, bidi smoking, vaping, e-cigarettes, hookah. The second cause is tobacco chewing. Even tobacco chewing can cause COPD. Third is occupational causes. Some people get exposed to different dust and chemical fumes in their occupation, and that can cause COPD. Thirdly, the second-hand smoke. It is equally injurious if the person who is smoking around you, it could be any of the family member or your friend, it is equally injurious. He is smoking the similar amount of number of cigarettes. So the problem is he is inhaling both the exhaled smoke as well as the different kind of pollutants which are there around. If he is in a smoking room, even that causes multiple exposures, even if he is not smoking. So second-hand smoke is one of the biggest cause. Fourthly, there are some childhood infections which happens during the childhood. It could be pneumonia. Sometimes even in the adulthood, it could be tuberculosis. Even that can cause COPD when the age advances. The primary test for diagnosis of COPD remains spirometry. We also call it pulmonary function test. It is a simple test in which you have to blow air and inhale air in a machine through a pipe, and that tells you about your lung function, and if it is deteriorated, we can easily diagnose COPD. Then comes further evaluation which requires some blood test as well as a chest x-ray. So the management of COPD is basically inhaled medication which helps. It could be an inhaler or a nebulizer in some form or some device, which usually is given morning and evening, and the role of these inhaler is to dilate the windpipe so that you have some ease in breathing. The other medications are supportive, And this is the medication part. Other than this, there are lifestyle changes which are required and some other methods which helps for COPD patient to improve their quality of life. So other than medical management, there is a role of vaccinations, especially influenza vaccine and pneumococcal vaccine, followed by lifestyle modification, in which you have to if you are a smoker, you have to stop smoking. If someone is smoking around you, you have to stop that exposure as well. It not just happens in smokers, even the indoor pollution as well as the air pollution causes it. So if there is the air quality around you is not good, you should wear an N95 mask when you're moving out. Even you should minimize the sources of indoor air pollution, which could be agarbatti, dhoop batti, hawan, the different mosquito repellents. Even when you are making food and putting tadka, even that exposure can cause COPD. Other than this, pulmonary rehabilitation is something which helps COPD patients at a very big extent. It improves their quality of life, the way they breathe, which includes some exercises and some breathing methods, how to breathe. And of course, there are different types of physiotherapies which are included in the pulmonary rehabilitation, which the patient has to follow, and it helps the COPD patient in improving their quality of life other than the medication. Of course, this is an irreversible disease. COPD is irreversible, but our aim is to prevent further damage of the lungs or further worsening of COPD, as well as improving the quality of life, which requires not just medication but also vaccination, lifestyle changes, as well as pulmonary rehabilitation.